Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Use of a class of antibiotics known as fluoroquinolones increases the risk of experiencing retinal detachment, according to research published in the April 4th issue of the Journal of the American Medical Association. Here is some information about retinal detachment. It is a condition in which the light-sensitive membrane of the back of the eye, known as the retina, begins to separate from its supporting layers. Without rapid medical attention, it can result in partial or complete blindness. Symptoms include blurred vision, many floaters in the eye, shadows or blindness in part or all of the visual field, and seeing bright flashes of light, especially in the peripheral vision. Researchers from the Child and Family Research Institute of British Columbia in Vancouver looked at the association between use of fluoroquinolone antibiotics and retinal detachment among nearly 1 million patients who visited ophthalmologists between January 2000 and December 2007. The more than 4,000 patients who experienced retinal detachment during this time were matched based on sex as well as month and year they entered the study, with 10 patients who did not develop this eye condition. Current use of fluoroquinolones was associated with more than fourfold increase in the risk of developing retinal detachment. It is important to note, however, that the absolute risk was low. Fluoroquinolone use was only associated with one case of retinal detachment per 2,500 people. For current users, the average number of days from the first fluoroquinolone prescription to the first event of retinal detachment was 4.8 days. Interestingly, neither recent nor past use of fluoroquinolones was associated with retinal detachment risk. There was also no association between the use of another popular type of antibiotic known as beta-lactams and the risk of retinal detachment. Today's research suggests that the toxic effects of fluoroquinolones on the eyes requires further study. It also suggests that those who are already known to be at risk for retinal detachment should be made aware of the symptoms of retinal detachment if they are prescribed fluoroquinolone drugs and advised to seek medical attention if these symptoms arise. For Insider Medicine in Depth, I'm Dr. Susan Sharma.